Your body has its own language. When something's not right, it doesn't just fail in silence, it sends out signals. It could be pain, maybe some swelling, or even a change in your skin color. That's where doctors come in, acting like detectives. These signals are the clues they follow to solve the mystery of what's really going on inside you.
All right, so where do we even begin? Well, just like any good detective, we're going to follow the clues. First, we'll tackle the body's loudest alarms. That's sudden, acute pain. Then, we'll move on to the physical evidence. Things like lumps and swelling. After that, we'll examine the visual clues, the ones written right there on the skin. And finally, we'll piece together the patterns of those longer-term mysteries.
So, first up, let's talk about probably the most urgent signal your body can send out. I'm talking about that sudden, really severe pain. This is basically your body's fire alarm, and it's screaming for immediate attention.
Yeah, we're not talking about a minor ache or something you can just ignore. This is a critical alert that something has gone very, very wrong. But here's the thing, the signal isn't just a generic pain. It's way more specific. Where it is, what it feels like, these are the first major pieces of the puzzle.
For example, let's say you have some really bad pain in your upper abdomen. That could point to a few different things, right? The initial alarm bell is the same, but the tiny details are what let a doctor narrow down the suspects. So let's see how they can tell the difference between two common culprits that live right in the same neighborhood, the gallbladder and the pancreas.
What's so cool here is how just a few subtle differences can point to completely different problems. So an inflamed gallbladder, that's usually going to cause pain up on the upper right side. But with pancreatitis, the pain is more in the center, and it often feels like it's shooting straight through to your back. The lab work then gives them that final clinching clue. A super high white blood cell count points to the gallbladder, but a sky-high amylase level, that pretty much fingers the pancreas.
Okay, now this phrase, this isn't just a symptom. It is a massive red flag clue. When a doctor feels an abdomen that's as hard as a board, that instantly points toward a perforated peptic ulcer, basically a hole in the stomach or intestine. And that is a true surgical emergency where every single minute counts.
This isn't your average headache that builds up over time. No way. This is a sudden, explosive, worst headache of your life kind of pain that hits you like a bolt of lightning. This very specific, named symptom is the classic sign of a subarachnoid hemorrhage, bleeding around the brain, and it demands immediate medical help.
But hey, what if the signal isn't this loud, screaming alarm? What if it's something a little more mysterious? Let's look at what happens when the body decides to build something new, like a lump or a swelling. It turns out the characteristics of this new thing are the crucial clues.
So you find a new lump. The very first question a doctor is likely to ask isn't just what is that, but is it tender? Does it hurt when I press on it? It seems like such a simple question, but in certain situations, the answer, whether there's pain or not, can completely change the entire direction of the investigation.
And this brings us to this brilliant, totally counterintuitive piece of medical detective work called Courvoisier's law. Now, you would think a painful, swollen gallbladder would be the absolute worst-case scenario, right? But what this century-old observation tells us is that if the gallbladder is swollen but it doesn't hurt, the cause is probably not gallstones. It's more likely to be a serious blockage, maybe from a tumor. So, what's really going on here is this. A long-term blockage from something like gallstones makes the gallbladder wall scarred and thick, so it hurts, but it doesn't get very big. On the other hand, a slow-growing tumor blocks the duct gradually, which lets the healthy gallbladder wall stretch and stretch, kind of like a balloon. It gets large enough to feel, but it happens without that acute, painful inflammation. So in this specific case, the lack of pain is actually the more alarming sign.
The body doesn't just communicate with feelings like pain. Sometimes the clues are literally right there for us to see, and these visible signs can offer immediate, incredibly valuable information.
Oh, a huge amount, actually. I mean, from the color of their skin and eyes to tiny little rashes or even just the shape of a joint. These are vital pieces of the puzzle that a skilled doctor can sometimes spot from clear across the room. And when a doctor sees a very specific combination of signs all together, it's like a code is being instantly deciphered right in front of them. Charcot's triad is one of the most famous examples of this. It's a clinical pattern that strongly suggests a specific and very serious infection.
So here are the three parts of that code. When a patient shows up with a high fever, pain in their upper right abdomen, and that yellowing of the skin or eyes, that creates a really powerful clinical picture.
Seeing this triad all together allows for a super rapid and confident diagnosis of cholangitis, which is a potentially life-threatening infection that needs urgent treatment. And I mean, these visual clues are just everywhere, and each one tells its own little story. A few tiny red spots on the chest could be a fat embolism. Shiny shins with no hair? Well, that's a tale of poor circulation. A small rash hiding near the ear can point to a very specific viral syndrome. Even the shape of a shoulder, going from nicely rounded to flat, is a dead giveaway for a dislocation.
Okay, for our last section, let's look at clues that aren't these sudden dramatic events. Instead, we're talking about patterns that emerge over time. These are the slow-burning mysteries, and they get solved by listening really carefully to the body's long-term story.
Well, sometimes the most important clue isn't what's happening to you right now, but the pattern of what's been happening for weeks or months or even years. The timing, what triggers it, how it progresses, that's the story, and it's absolutely critical.
A perfect example of this is a condition called intermittent claudication, which is a real hallmark of chronic arterial disease. It's the perfect case study for how a patient's story and a physical exam just click together to solve the mystery. So, first you have the history. The patient tells this very specific story. It's something like, "Doc, my calves start to cramp up after I walk about 2 blocks every single time. If I just stop and stand there for a minute, it goes away, and I can start walking again." See, that pattern of pain brought on by a predictable amount of activity and then relieved by rest, that is the classic narrative.
Then comes the examination, which provides the physical evidence that backs up the story perfectly. The doctor might find that the pulses behind the knee or in the foot are really weak or maybe even gone. And they'll see those other visual clues we just talked about, that shiny skin and hair loss that points directly to chronic poor circulation.
And this right here is the fundamental equation in medicine. The patient's story, their history, provides all the context and the framework. The physical exam then provides the objective evidence. And when you put them together, when the story and the evidence align, boom, the diagnosis becomes clear.
So, from a sudden, sharp pain to a subtle change that happens over months, your body is always telling a story. Now, understanding these signals isn't about trying to diagnose yourself, of course. It's about appreciating the incredible, complex language of your own biology and knowing when it's time to call in a detective.